think if somebody comes to that extent, there is no other option apart from surgery to make it straight. These some more pictures regarding the same condition. Now this is the most common. I think I can say this is the most common condition. We see the flat feet has become enormous problems now, because it has been found that most of the new generation, the children particularly of the new generation, have got this flat feet, and different causes have been discussed for this. We will not go into detail of that. How it looks if you are weight bearing, the arches drop completely and the whole foot is flat. Now the treatment depends on what you want to do. If it is still okay, all treatment starts first of all to wear a nice footwear, and if necessary to modify your footwear with insoles like this. You can put an insole which will support the arch, which can be possible only when the feet or flat foot is more flexible. That means it can be correctable. If it becomes rigid, this is not possible. So the management is usually the proper footwear, and you need to do exercise for foot. Of course, you need to control your weight for all like our other arthritic conditions, and you can wear shoes which I have told you with insoles, and there are some inbuilt shoes with the inbuilt with insoles which will be much preferable as well. So then, if you all fail and the feet, the flat foot become more rigid, not passively correctable, then you go for surgical procedures. So which will be just, this is the arch is flat completely. It should be like, bone should look like that. So it's almost to the ground. The heel and the big toe is on the same level. So we do variety of corrections to make the arch back into place, and sometimes we have to fuse some of the joint there. And this is the worst type of flat feet where the heel is completely in valgus position. Then this will not go into details of that as well. Now the other common condition which I would like you to know is the arthritis of the ankle, and how do you manage. Is arthritis of the ankle is like any arthritis in the body, like knee arthritis, hip arthritis, and it's as common as the other arthritis. The management, this is one of the pictures where people have to walk on the side of the foot if they've got pain. So the posture, walking posture also become difficult, and what we call antalgic gait means they walk with limping, with pain. And then it looks in the X-ray, the whole joint space is reduced completely. The X-ray shows that we can confirm by X-ray, and now this can be managed by variety of ways. If once it comes to that stage, apart all conservative measures like analgesics or modifying your footwear, we're using high level boots, or which will cover the ankle, boots like which will cover the ankle, then we come for the operative intervention. So this is one of the simplest way of treating arthritis of ankle, which is